Staying safe from coronavirus within your own home, COVID-19 tips from official government scientific advisors. You may not be safe from COVID-19, even if you stay holed up at home in lockdown. That's the key message from leading virus experts who are particularly concerned about the virulent new mutant coronavirus strains that have recently emerged in Britain, South Africa and Brazil. In response to this threat, official scientific advisors to the government in England have just set out a list of measures that you personally can take in order to help keep you safer in your own home and reduce your risk of getting infected with coronavirus, by people you live with including family members, or by visitors, tradespeople or carers who come into your home. SAGE, the Scientific Advisory Group for Emergencies, warns that the risks from the transmission of COVID-19 within homes are likely to be elevated due to the new variants, and that lockdown alone may not be sufficient to reduce infection rates. They state with high confidence that the new variant of the COVID-19 virus, variant B1.1.7, represents a significantly increased transmission risk. Thus, the need to reduce all routes of transmission, including within households, is greatly heightened. These should be in addition to the rigorous application of measures outside your household including physical distancing, face coverings, ventilation, hygiene, vaccination, and effective testing, tracing and isolation which are essential for reducing the likelihood that infections enter the household in the first place. SAGE specifically advises as follows. Within household transmission is a very common setting for COVID-19 transmission. During lockdown, homes become a more important environment for transmission as most activities beyond the household are subject to restrictions. The risks from transmission within households are likely to be elevated for the new variant, B1.1.7, due to its increased transmissibility. Transmission from one person to others within a household is not inevitable, and measures can be taken to reduce the risk of secondary infection. Transmission between household members can be mitigated through the application of a combination of personal, procedural, and environmental controls, both as preemptive measures and as enhanced measures implemented immediately when any household member has symptoms or is a possible or confirmed close contact of a case. Enhanced measures are also likely to be beneficial when a household member is vulnerable. When the epidemic is sufficiently controlled by reducing between household mixing, reduction of within household transmission can potentially make a substantial contribution to further reducing prevalence. Successful reductions in household transmission have the potential to contribute to reductions in hospitalizations and mortality, and increase health service capacity. So, in short, you are not necessarily safe in your own home. Despite within household transmission representing a very common mode of COVID-19 transmission, the good news is, however, that secondary transmission from one person to others within a household is not inevitable. SAGE has high confidence that measures can be taken to successfully reduce the risk of secondary infection which may, in turn, have a major impact on population levels of transmission and R number. And the SAGE scientists have now issued a detailed list of things you personally can do in order to increase your chances of staying healthy and virus-free within your own home. Among the enhanced measures suggested for all households, you should keep a window open at night in a shared bedroom where practical. You should also avoid sharing towels. Also, restrict visitors to only those who are essential, and encourage them to wear face masks. Meanwhile, washing hands immediately after returning home yourself is good practice, the scientists add. The SAGE document, published on Friday 15 January 2021 on the official British Government gov.uk website, lists detailed steps, which they refer to as enhanced measures, that you should take if you or someone else living in your home is likely to be vulnerable to COVID-19. It also tells you what to do when a member of your household is quarantining after coming into contact with an infected person. And it informs you as to what precautions to take when isolating at home after someone living in your household has contracted the virus. In the description below this video, we are posting a link to the original, full SAGE report. But, so that you don't have to wade through 24 pages of dense text, we are bringing you the key points from SAGE now in this video. Viruses including COVID-19 are transmitted in three main ways: close range, airborne and surface contact. Here is the SAGE advice on combating all three ways. Number 1. Infection control measures for all households. Restrict visitors to your home to only those who are essential. Maintain distance as far as possible from any visitors to the home. Keep visits as short as practical. Regularly air rooms, open windows and/or use extractor fans before a visitor arrives, during their stay and for a short while afterwards. Maintain comfortable temperatures and indoor humidity. Shared bedrooms have been shown to pose a risk, so keeping a window open slightly at night where practical may be beneficial. Ensure plumbing systems are in good order, as it is possible that some people may shed the virus through their poo. Ensure the house is kept clean, especially bathrooms. Studies have shown that these can be more contaminated. Clean after any visitors have come into the home. Avoid sharing towels and other surfaces that are hard to clean, especially in houses of multiple occupation shared by unrelated adults. The risk of transmission increases as the number of people in a household increases. And shared spaces, surfaces, and objects, such as kitchen and bathroom areas, have a high potential for virus transmission, and this risk increases with the number of people and frequency of use. Close toilet seat lids before flushing. This can minimize any contamination of the environment by airborne poo particles. Excessive cleaning could cause other health issues due to exposure to chemicals, so maintain good ventilation during cleaning activities. Ensure good ventilation during activities such as high-energy exercise in shared indoor spaces. Pay particular attention to good hygiene during food preparation and ensure cutlery and crockery are washed thoroughly. Wash hands regularly and immediately after returning home. Safely dispose of tissues and immediately wash your hands afterwards. If any tradesmen come into your home, insist that they wear a face mask, and make sure that you wear one as well while they are there. Number 2. Measures when a person in the household is likely to be vulnerable to the severe effects of infection. In addition to the measures above, the SAGE scientists advise regular asymptomatic testing for anyone in education or working outside the home in public-facing roles. Keep areas where a vulnerable person has to interact with anyone else well ventilated. Maintain greater distance between the vulnerable member and others in the household, such as sleeping in a separate room if possible and rearranging furniture to make distancing easier. Limit the use of shared objects such as towels, cutlery, and crockery. Maintain hand hygiene and don't breathe on anyone else. Strongly encourage any visitors to your home to wear face coverings. Number 3. Measures when a member of your household is quarantining after being a suspected contact of someone with COVID-19. In addition to the measures above, the SAGE paper advises restrict the contact to a different room as far as possible. Ensure rooms where the contact spends time are well ventilated, especially if they have to be shared with others. Do not allow any visitors to come into your home unless they are critical for health, care, or emergency reasons. Avoid activities that may generate aerosols, such as singing or high-energy exercise within shared rooms in the home. Limit the use of shared surfaces and objects. Where possible, contacts should use a different bathroom to avoid contaminating surfaces. Where this is not possible, they should always clean the bathroom after use. Contacts should avoid preparing food themselves as far as possible, and where this is unavoidable, they should use kitchen facilities at a different time and clean afterwards. Where possible, the contact should eat separately from the rest of the household, ideally within the room where they are quarantining. Wash clothes, towels, and bedding more regularly. Ensure enhanced hand hygiene for all household members. Evidence suggests that wearing face coverings where there is a case in a household can reduce transmission. If the contact has to interact with others, it would be beneficial for them to wear a face covering. These should be washed or disposed of regularly and properly. Number 4. Measures when a member of your household has tested positive and they and the rest of your household are isolating. In addition to the measures above, SAGE advises that you should assume that any member of your household could be infected. Confine the person who has tested positive to a different room as far as possible, with their window open and the door closed. Maintain greater distancing between all other household members in case others are infected. Maintain good ventilation in all rooms where people spend time. Not allow any visitors to your home unless they are critical for health, care, or emergency reasons. Restrict all use of shared objects as far as possible between all household members. Maintain an enhanced standard of cleaning throughout the whole house. This is likely to be beneficial. Always insist that any people carrying out domestic and caring work in your home wear PPE, personal protective equipment. Ensure high-touch surfaces, such as door handles, and items such as cutlery and crockery used by the infected person are cleaned thoroughly. Ensure enhanced hand hygiene for all household members. Wash clothes, towels, and bedding for all household members more regularly, with those from the infected person done separately and on a hot wash. There may be benefits to all adult and adolescent household members wearing face coverings if they have to interact with the infected person or in close proximity to each other. These should be washed regularly and/or disposed of properly. Where care needs to be provided to an infected person, additional personal protective equipment such as gloves and eye protection may be beneficial. And finally, good hand hygiene following any care of an infected person is essential. Are you taking any of these preventative measures already? Or what new things have you learned from this video that you are now going to apply? Be sure to tell us in the comments below. And, if you found this video useful, remember to like it, share it on social media and, if you're new here, to subscribe to our channel. This all helps to let the YouTube algorithm know that this is a good video and channel worth showing to other people. Consider it your good deed for the day. Meanwhile, do check out our many other useful informational videos. 2 suggestions are on screen for you now.